All right, so today we're going deep on a document that really got me thinking about how medical education works in India.
Okay, sounds interesting.
You actually shared this with us, remember?
Oh, right.
It's called Urgent Need for Structural Reforms in the National Medical Commission, NMC. Pretty straightforward title.
To the point.
Yeah, and it's from the National MSc Medical Teachers Association, the NMMTA.
Gotcha.
Their main point, and it's a big one, is that the NMC seems to be, well, pretty biased towards doctors.
Okay, I can see how that might be a problem.
Yeah, they think it could be hurting the quality of education overall.
Huh. So what's their evidence?
One of the things they do is compare the NMC here to the UK's National Health Service.
Interesting comparison.
Right. The NHS board has 50% laypersons, regular people, not medical professionals.
Yeah.
The NMC, almost all doctors.
Wow, that's a stark difference. 50% lay representation, you don't see that every day.
Exactly. So what does the NMMTA think this all means for medical education in India?
Their big argument is that non-doctor educators, folks with MSc and PhDs, but not MBBS degrees, they kind of get pushed aside.
Meaning they don't have as much say?
Right. And that affects policy decisions, making it harder for these really qualified educators to, contribute to the system.
So it's not just a feeling. There are actual policies that might be putting non-MBBS educators at a disadvantage.
Precisely. The document specifically talks about appointments and promotions. The NMMTA says the guidelines often favor MBBS qualified faculty,
creating a kind of glass ceiling for those without that specific degree, even if they've got tons of experience and a great teaching record.
Exactly. It can be really disheartening if you're passionate about teaching future doctors but keep running into this wall because you don't have that one specific degree.
I bet. The NMMTA is saying this leads to, disillusionment among non-MBBS faculty.
And as they see it, it has a domino effect. Discourages talented people from even going into medical education as a career.
So you end up with shortages in certain areas, like preclinical and paraclinical subjects, that could have been filled by these qualified individuals.
That's their point, yeah. And they highlight that this over-reliance on feedback from doctors, especially when they're often competing with non-MBBS educators for jobs.
It creates a skewed perspective, right?
Right, because it's like relying solely on one interest group's opinion to shape policy, especially a group that might have a reason to keep things the way they are.
Makes you think, could that really lead to policies that are truly fair and effective for everyone?
Yeah, it does make you wonder. And they give some specific examples of this in the document.
Like what?
They talk about how the NMMTA offered proposals to recognize medical MSc and PhD faculty as, equal teaching staff, giving them the same opportunities for recruitment and career advancement, that sort of thing.
So basically a level playing field where your qualifications and experience speak for themselves, not just having that MBBS.
Exactly. But according to the NMMTA, these proposals kind of went nowhere.
So they're hitting a wall. Must be frustrating to feel like you're not being heard, especially when you're trying to improve the entire system.
Absolutely. And that's a key point they make. This isn't about self-interest. It's about making medical education in India better for everyone. They believe that having more diverse voices in the mix when it comes to policy making would actually lead to better outcomes all around.
Okay, so we're seeing how this imbalance, this structural thing within the NMC might be preventing the system from reaching its full potential, at least according to the NMMTA. But do they just complain, or do they actually offer any solutions?
Well, they absolutely offer solutions. They've got a whole set of pretty big reforms they think could fix these problems and make medical education in India more fair and more effective.
All right, so let's hear about these reforms. What are they proposing?
So one of their big suggestions is a pretty major shift. They want to see the NMC restructured to include a much wider range of, stakeholders.
More voices at the table.
Yeah, more than just doctors. They're talking about including more non-doctor educators and even representatives from other fields that are, connected to healthcare.
Makes sense to me. If you're making decisions that affect the whole medical education ecosystem, shouldn't everyone have a say, not just one group?
Exactly. And the NMMTA is also really pushing for more transparency within the NMC.
Transparency, like being more open about their processes.
Right. Right now, they claim the decision-making happens behind closed doors. Little to no consultation with non-doctor educators.
And they're proposing.
They want a system where any proposed policies or decisions are open for discussion and feedback from all stakeholders.
So a big cultural change within the NMC.
Yeah, it would be. They even suggest setting up some concrete things like clear channels for communication and feedback, maybe even committees with people from all the different groups.
That way, concerns and suggestions can be addressed head on instead of being ignored, right?
Exactly. It's about moving away from that top-down, we decide everything approach.
Creating a more collaborative and inclusive environment.
Yeah, exactly. And they're not stopping there. They also want to see a systematic review of all those policies and guidelines that might be, even unintentionally, disadvantaging non-MBBS educators.
So they're saying, let's look at the system itself, not just who's at the table.
Right. They're proposing an independent panel with experts from all sorts of fields to really scrutinize these policies and recommend changes, all to make sure everyone has a fair chance.
This is going beyond just representation. This is about fairness at a fundamental level.
That's a good way to put it.
Yeah.
And they don't stop there. The NMMTA is also saying, hey, let's recognize and actually value the expertise that non-MBBS educators bring.
Which is?
Well, think about it. A lot of these educators have PhDs in super specialized fields like biochemistry, pharmacology, anatomy.
Wait, but those are foundational subjects for medical students, right?
Exactly. So it seems odd to devalue someone's expertise just because they don't have that MBBS when they've dedicated their lives to these crucial fields.
Yeah, it does.
Yeah.
So what do they want to do about it?
The NMMTA suggests creating clear paths for these educators to advance in their careers, like actually recognizing their specialized knowledge and what they contribute.
So not just fairness, but making those fields more attractive to talented people, solving those shortages we talked about.
Exactly. Now, it all sounds very logical and well thought out, but it makes you wonder, if these ideas make so much sense, why haven't they been implemented yet?
Right. Is it just people resisting change? Or is there something more going on here?
Well, it's complicated, right? I don't think there's an easy answer. Part of it might just be that big institutions are kind of slow to change, especially when it involves, a shift in who has power.
Inertia. Even if some people know things need to change, actually getting it done in a huge system like the NMC, well, it's a massive undertaking.
Right. And the NMMTA gets that. They know reforming the NMC won't be easy, but they're not giving up. They really believe these changes are essential for the future of medical education in India.
It's a big fight, but it sounds like one worth fighting. I mean, a strong medical education system is so vital for the health of a whole country.
Absolutely. And the NMMTA argues that even if their reforms seem like a big shakeup, in the end, they're all about making the system more inclusive, more transparent, and, really focused on quality.
So it benefits everyone, educators, students, and eventually the patients.
Exactly. Now, there was one more thing that really stood out to me in the document. It kind of shows the potential consequences of this, alleged bias within the NMC.
What is it?
Well, the NMMTA brings up the National Exit Test, NET-XT. You familiar with that?
Yeah, it's supposed to be like a standardized exam for every medical graduate in India.
Right.
To make sure everyone's meeting a certain standard.
That's the idea. But the NMMTA says there have been some delays in implementing NXT.
Delays? Why?
Well, they think it might be connected to some concerns about the quality of graduates coming out under the current system. Specifically, they point to the fact that the NMC actually had to lower the qualifying percentile for NEET PG admissions.
Oh, wow. Are they saying that some people don't want NEC-ST because it might, reveal some uncomfortable things about the education quality under the NMC's watch?
That's what they seem to be implying. They think a tough, standardized exam like NEC-XT would hold everyone accountable. Institutions, educators, and students. It would force everyone to ensure a certain level of competency.
I see. So it makes you wonder if there are people within the NMC who are pushing back against this level of scrutiny because it might shake things up too much, expose weaknesses, or maybe even threaten their own position?
It's a valid question and one that the NMMTA is definitely raising. They argue that delaying NEC-ST not only hurts the goal of improving graduates, but also makes it look like the NMC's more interested in protecting itself than serving the best interests of the medical profession and the public.
It's a bigger conversation now, isn't it? Not just about non-MBBS educators, but about transparency and accountability in the whole system.
Yeah, it is. The NMMTA is saying that a system that only cares about the interests of a small group will ultimately fail to do what it's supposed to do, serve everyone.
So this has been a really insightful look at the NMMTA's perspective. They've definitely raised some big questions about the NMC and how it's shaping medical education in India. What are your final thoughts on all this? What should our listener be taking away from this conversation?
Well, the NMMTA really believes that the NMC, needs some big changes. And not just for non-doctor educators, but for the whole system, the students, everyone.
They're really arguing that ignoring diverse voices will backfire, that it could actually hurt patient care in the long run.
Right, because the goal is to have great doctors who can provide excellent care, right?
Yeah, of course.
But if the system that's supposed to be in charge of making sure those doctors are well-trained is messed up,
Yeah.
well, that's going to have consequences down the line for all of us.
Makes sense. So what's the alternative? What does the NMMPA actually want to see? We talked about more transparency, structural changes,
Yeah.
but what does that look like in practice?
They basically want an NMC that actually represents everyone involved in medical education.
All the stakeholders.
Yeah, where decisions are made out in the open, collaboratively,
Yeah.
and where the expertise of people with PhDs in these crucial subjects,
Biochemistry, anatomy, all that.
yeah, where that's not just acknowledged but actually valued.
Used to shape the curriculum, teaching methods, all of it.
Exactly. They think that kind of open environment where the best ideas win, no matter who they come from.
That would lead to some real innovation in medical education in India.
That's the hope.
But I mean, is that even possible? Can you really change the culture of a huge organization like the NMC that drastically?
It's definitely a big challenge. The NMMTA knows it won't be easy or happen overnight.
Yeah.
But they're saying, look, gotta start somewhere. This document is like their call to action to the people in the NMC and the whole medical community who see that things need to change.
It's interesting to think about for our listener who might not be a doctor or a medical educator but still cares about good healthcare in India.
Yeah.
What do you think is the most important takeaway here?
I think it's that how we train doctors has a huge impact on the kind of healthcare we all get. If we want top-notch healthcare, well, we need a medical education system that can actually produce those top-notch doctors.
And that means a system that embraces different perspectives and really prioritizes quality.
Exactly. The NMMTA's document, even if you don't agree with everything they say,
It's a starting point.
it makes us think about how things work, how they could be better, and to speak up when we see that the system isn't working the way it should.
So to everyone listening, we want you to think about what we've discussed. Do you think the NMC needs to change? Would a more inclusive, transparent system be better for everyone?
And what can we all do as patients, as citizens, to make sure our healthcare system is the best it can be?
Lots to think about. Thanks for joining us on this deep dive into a pretty complex but really important topic.
It was great to be here.
Until next time, keep those minds curious.